Welcome back. Last week, Richard, we talked about some of the problems and concerns associated with labeling children with, well, we talked last week primarily about labeling children with learning disabilities, but we talked about the concerns associated with providing any label and the potential self-fulfilling prophecy associated with that.
Exactly. Yeah. Yeah. There are advantages and disadvantages to labels. In educational, in schools, the one of the advantages of labels is that it gets you services. You know, if you can say that a child has a particular disorder, then the child qualifies for extra services.
That's right. Right. So this week we're gonna kind of branch off of that from last week and talk about the advantages, some of the advantages associated with providing labels. And we're going to begin with the idea that, I remember my initial training. You and I have talked about this many times, maybe not on the podcast so much, but certainly as we were talking about our work over the years. My early training, and I know your early training, emphasized the importance of an accurate diagnosis.
Right.
And, a lot of times these days, people will jump to diagnoses very quickly. As soon as they see a couple of symptoms, they will grab onto a diagnosis, and even professionals will throw a diagnosis out there and begin treatment. And lo and behold, after a couple of weeks, that treatment is no longer effective, and then they go back to the drawing board. And our early trainers would have said, that's because you got the diagnosis wrong.
Exactly, right.
And so today we're going to talk about learning disabilities specifically and talk about why it's important, to make a correct diagnosis and what benefit that will actually have for the student.
Right. And we see this playing out today in a couple of different diagnostic categories.
Right.
Because our diagnostic decisions are based on the on symptom presentation. In other words, you have these symptoms, and if you have these symptoms, then the conclusion is you have the disorder, and that's not necessarily true. And I think we've seen that with ADHD. I think we're seeing it currently with autism. Even some professionals, they see a child who has a couple of the classic symptoms of autism, and they say, well, you have these symptoms, so you have to have the disorder.
Right.
And it doesn't logically follow that because you have symptoms, you have the disorder. The other thing that's beginning to emerge in psychology and psychiatry is that we know that certain symptoms appear across disorders.
Right.
And so, just because you can't attend doesn't mean you have ADHD. Or just because you have poor impulse control. Yeah, those are the classic symptoms, but it doesn't mean you have ADHD, because now we know enough about the brain to know that the same brain systems are involved in various disorders. And so we have to be careful about relying only on symptoms.
Absolutely. And I think that's a critical point. And that is that just because you have certain symptoms doesn't mean that you have a disorder. It doesn't mean that there's something wrong.
And I think we have to be very careful, because you can have symptoms and be completely normal, neurotypical.
Right.
Many of us have certain symptoms of disorders, but we would still fall in the broad category of normal.
Right. And we can induce some of those symptoms involuntarily. You can you put a person in a neurogenetics or a molecular genetics course, who's never had the background information, and they're going to look like they have ADHD in that class because they're not doing any of the work. They're
doodling, looking around, right? Yeah, looking out the windows, falling asleep.
Right, and it also introduces the some of the significant difficulties and challenges associated with childhood mental health and our work with kids, because the same symptoms could be present or could be manifest for several different conditions,
Right.
And I think that it's really important to mention that at some developmental level or in some conditions, every symptom that we associate with mental illness or a mental health condition is perfectly normal and acceptable.
Exactly.
Nobody scoffs at a 5-year-old who has an imaginary friend.
Right.
A 25-year-old with an imaginary friend is a very different situation.
Right.
So we look at some of these symptoms and characteristics, and at some times they're perfectly acceptable and perfectly normal, but other times they're not. Uh, Related to what we're going to talk about today, when we think about learning disabilities, we think about things like dyslexia, for example, and people will, say, well, the child is reversing letters. Well, reversing letters is perfectly developmentally normal until about the age of 8, 9 years old. So about third grade. Kindergarten, first and second graders who are reversing letters, that doesn't mean that they have dyslexia, but
Dyslexia, right.
we have to look at those symptoms and characteristics within a context. And so we have to be careful about jumping to those labels, just like we talked about last week.
Right. Yeah, because and the other thing about labels is that once you attach a label to a child, one of the problems is a self-fulfilling prophecy. You have a learning disability, so you're stuck with this for the rest of your life,
Right.
which may not be the case. You have autism, it may not be the case. So it's a self-fulfilling prophecy. The other thing is that you're laying all the blame on the child. There's something wrong with you internally, and you don't take into account teaching or parenting or environmental influences. It's something wrong with the child. And the other thing is you send the wrong message to the child, because you're saying to the child or the adult, you have this disorder, and so it makes the person feel like, well, there's really nothing I can do about it. I was born with this thing. So labels can send these messages, and the worst for me, the worst is, you can't do this on your own. You have to have accommodations.
Right.
What kind of a message does that send to? You're not capable of doing this like everybody else in the room. We need to do something special with you. Okay. So while we understand the need for accommodations, we have to be very careful about the other message, the other side of that coin, that there's another message there. Having said that, you raise all these problems with labels. The fact is, there are kids who do need help.
Right.
There are kids where there really is something wrong.
Right.
And one of those groups is kids with specific learning disabilities.
Right. And so we'll start out with a little bit of a history of learning disabilities, because I think it's important that we look at it within a developmental context.
Right.
And again, thinking about what we're actually talking about with a learning disability, as opposed to some other difficulty. We're going to talk in just a few minutes. We'll be talking about what I refer to as a curriculum disorder, because the student is having a hard time, but it's not really the kid's fault. It's
we're gonna have an epidemic of that, Dr. Berney.
Yes, we are.
This fall, we're going to have an epidemic of curriculum disability.
Yes, we will definitely be getting into that in just a few minutes, because that's going to be, I don't even know what we're going to do about that. So, but first, a little bit of history about learning disabilities. Surprisingly enough, it wasn't until the late 1960s that the federal government even first recognized learning disabilities, right?
Despite the fact that they were first described in the 1800s.
Right.
This is not new.
Right.
This idea of learning disabilities and ADHD and all these things, they're by no means they didn't emerge because of modern culture,
right,
or video games or the internet.
Right.
These things have been around since the 1800s.
Right.
Okay, but usually by physicians. They would eventually see these kids, and they would notice these sort of odd behaviors that some kids manifested. But yeah, this goes back into the 1800s.
Yeah, but not until the 1960s did we get any ruling from the federal government that said, we should be educating these kids with learning disabilities.
And curiously, you talk about the 60s. The field of learning disabilities was born out of the civil rights movement,
Right.
because the first time, it was Brown versus Board of Education,
Hmm.
1954, that this idea of separate is not equal.
Right.
That's what that was about. And that was based on a person's skin color. And we said, no, you can't segregate schools because these schools are not equal. You're not getting an equal education. And so parents of children with learning problems, and in the 30s and 40s, we knew this, there were certain kids who seemed to be able to do everything
Hmm.
except read or
Right.
calculate or write, they were completely normal in all other ways. There was no mental impairment, there was no cognitive impairment, but they simply struggled. And some never were able to learn, but never able to learn how to read, never be able to write. And the parents knew that. They said, my kid's normal. But these kids were put into usually separate schools.
Right.
Some of them were put into state institutions.
And I think that
Which is
that's such an important point, because and I worry that today's podcast we're going to follow some of these rabbit trails a little bit. But you know, Richard, what about those people that talk about, the golden years, the good old days,
the good old days.
when everybody behaved in school, and students all did what they were supposed to. Usually they're talking about 1940s, 1950s, even to the 1960s. But at those times, a lot of students with disabilities were not in school. And not that we would blame all students with disabilities as creating the problems in schools or anything like that, but it creates a lot of diversity in school.
Right.
And when you have a lot of diversity, it puts another layer of challenge into the management and the organization of the school.
Forrest Gump grew up in those years.
Right.
And if you've ever seen Forrest Gump, you know how he got his accommodations.
Right.
He couldn't get into the building. I mean, he had leg braces, and so he was just barred. And it was just assumed that if you had any kind of condition, if you couldn't access the building and the curriculum, you couldn't go to school.
Right.
And that's what parents rebelled against. They said, wait a minute, our children deserve to be in schools. You shouldn't put them in church basements. And literally that's what was happening to these kids, is they either didn't go to school, or they were put in separate facilities, or they were put in state institutions. And the parents finally, based on what they saw with the civil rights movement, said, wait a minute, we have rights too. We should be doing a similar thing. And that's why the 1960s are so important for this movement, because it came out of that era of the 1950s where kids were excluded from schools. I'm sure when were you in elementary school?
Late 70s.
70s.
Started in the late 70s, yeah.
It was just beginning when you were in elementary school. I never saw a child with a handicapping condition. I never saw a child I don't think. We probably had kids with learning disabilities, but they just did poorly in school, maybe dropped out when they were 16. But we were never aware of kids with special needs, because they weren't in school buildings in the 60s.
Right. And see, and I remember it because, and as our timeline progresses, in the late 60s, we have our very first federal legislation that said to be educating these children. And then that evolved, and that was with Public Law 94-142, the Educate All Children Act. And then that later evolved into, some additional legislation, and eventually went to the Individual with Disabilities Education Act, the IDEA, and which has been reauthorized a variety of times over the years and is still in act today. But all of that really started to, get set in the 1970s. When I was in elementary school, I remember students being pulled out of school or out of the classroom to go to other classrooms for things. I have family members who have had different either learning disabilities or different things, and they would be pulled out to go to other classrooms. Certainly remember kids, were just before lunch they would get called to the office, and we had no idea what was going on, but those kids were getting called down to take ADHD medication.
Right.
Because at that time they only had the short acting
Mhm.
medications. And so, we really started to see those things emerging in the mid to late 70s, and certainly by the 80s, that was really taking root. And we were seeing a lot of special education classes, and we started talking about all of the different exceptionalities identified under the Individuals with Disability Education Act.
Right. Yeah, um, because prior to 1975, um, kids were excluded. If you couldn't handle the regular curriculum,
Mhm.
kids were excluded. You were put someplace else,
Right.
hidden, stayed at home, but you weren't in the regular classroom. And it infuriates me when so-called psychologists, or usually they're writers, newspaper columns, will say, well, when I went to school, we didn't have the, they were tough on us. And no, you had a very homogeneous group.
Right.
There were no kids with ADHD. The kids who had ADHD got punished and kicked out of school.
Right.
If you couldn't handle what was going on in the classroom, you were removed permanently. There just wasn't a place for you. So it wasn't that we were more well-behaved, but the kids who had problems simply weren't present. They weren't in the classroom.
Because if you think about it today, 80% of children, roughly 80% of children,
Right.
fine. They don't need anything. And if you had a school of just those 80%,
We call those magnet schools.
right, it would look just like it did back.
You can have a selective admissions policy or a selective retention policy, and you keep just the 80%. You don't have serious discipline problems because you're excluding that. What happened in 1975 with the Education of All Handicapped Children Act, as the name implies, we're saying, no, those kids deserve an education too,
Right.
whether it's color of skin, handicap and condition, gender,
Right.
like you have the whole Title IX movement. Everybody deserves an opportunity to have the same education. Okay, that's what changed in the 70s was inclusion, because before that they were excluded. In the 1970s they are included,
Right.
and one of those groups is a group of kids who seem to be normal in every way,
Mhm.
but who simply can't learn what's
Right.
presented in our standard curriculum.
Right. So that of course brings us to specific learning disabilities, SL.
Right.
And when we think about learning disabilities, I did a workshop, or I did a little talk on this the other week, and Dr. Mars, the only way that I could really narrow it down for the group that I was talking to is learning disabilities is a diagnosis of exclusion.
Mhm.
You rule out everything else. And after you rule out everything else, if there's still a problem and you don't have an answer to what's going on, then that's probably a learning disability. So you're ruling out intellectual problems, you're ruling out other developmental problems, you're ruling out medical problems. And if you rule out all of those things and say, there's none of those things happening, it's probably a learning disability.
Right. Yeah, the child can hear and see, and there's no medical problem. There's no biological problem that seems to be causing it. You're right. It's a diagnosis by exclusion.
Right.
Mhm.
So that in and of itself introduces some challenge,
Right.
because it's not, you used the word a few minutes ago, is thinking about a homogeneous group where everyone in the group looks about the same. Well, when it comes to learning disabilities, that is a very heterogeneous group. Everyone is a little bit different.
Right.
We
Yeah.
try to create little categories based upon symptom presentation, but for the most part, every student with a learning disability is a little bit different,
Mhm.
and it creates a lot of headache when trying to introduce interventions or strategies to help these students, because what works for one student may not work for another student, even if so many of the characteristics look exactly the same.
Right.
There's some subtle difference that we may or may not be able to recognize that will make a treatment effective for one kid and not effective for another kid.
That's right. You can't think of specific learning disabilities as a monolithic structure. It's not. It's more like a stew. There's a lot of little pieces. There are a lot of little facets to this thing. And you're right. They're all different.
Right.
You try to categorize them as much as you can. If a child has a reading disability, So you put those over here, it's a math disability, it's over here. But you're right. It's a very heterogeneous group. There's a lot of variability in that group.
Right.
And the other thing is, the important points to remember is that this is a hypothetical concept. We don't know. I mean, we call it that so that we have a common vocabulary, because it does make a difference whether we're talking about autism spectrum disorder or specific learning disabilities.
Right.
It's a huge difference, and we have to have this vocabulary so we can talk to each other.
Right.
But it is a hypothetical construct, so you can't say this child has a learning disability and that's the reason she can't read.
Right.
No, it's not. It's not meant to be an explanation.
Right.
No, because it's hypothetical. There's no real thing. At the same time, we do believe that there's something different about how this child's brain
Right.
manages information.
Right.
So hypothetical, but
right. And there is some good research about that. So, but first, so when we think about learning disabilities, let's quickly suggest that there's 4 different types of learning disabilities. Really, only 3 that are recognized in schools.
Right.
But there's really 4 learning disabilities. You have a reading disability, which we call dyslexia. We'll get back to that in just a second, because it's not necessarily some mysterious letter reversal thing. Dyslexia just means difficulty reading. That's really all that means.
Right.
Dysgraphia, which is a written expression disorder. Dyscalculia, which is a math disorder, and what we call a nonverbal learning disability, which is another, which really isn't recognized too much in schools, but it's associated with difficulty with social skills and social interactions. And if we think about what we used to refer to as the autism spectrum, where you had on the severe end, you had severe autism, and on the mild end, you had something referred to as Asperger's disorder. We don't have that diagnosis anymore thanks to DSM-5. A little bit more towards the mild end of things from Asperger's would be specific nonverbal learning disabilities down there. So it's some of those similar traits, but more on the mild end of that autism spectrum, perhaps.
Right.
But again, it's not really recognized in schools at all.
Right.
So in schools, we only look at reading, writing, and math.
And we have these 3 groups, and if you've ever seen a child with dysgraphia, it just looks like whatever the brain normally does to put words on paper, this brain doesn't seem to do that. Okay. Right. And you have to attribute it to the brain because that's where these things happen.
Right.
Can we find out what's going on in the brain? No. We don't have the technology to study neural pathways.
Right.
And to get a clear explanation of what the brain is doing. We just don't have the technology to image the brain in that way. But we're making the assumption that there's some underlying brain problem.
Right. And, so thinking specifically about dyslexia, for example, we know from some of Stephen Pfeiffer and some other researchers, some of their good work, Shaywitz's and some of their really good work with dyslexia, that there are subtypes. There are subcategories within dyslexia based upon the way in which the students' symptoms present. So if they're adding phonemes, if they can't do phonemes, meaning the individual sounds of the letters and then blending those sounds together to make the word. Some students have difficulty reading the whole word. That's sort of like a visual. And then there's a few others that are sort of in between and include all of those things. We try to differentiate those, but again, the intervention that we would use is going to vary. But Joe Torgerson and some others have done some really fascinating research looking at that neurobiology, and they've done MRI, functional MRI, and some different scans of brains while they're reading before and after intervention. And there are some changes that happen in the brain at the neurobiological functional level
Right.
when a student is a non-reader versus when they are a reader. But it's not diagnostic. And again, that's the point that we're trying to emphasize here is, yeah, you can see some of those differences, but those differences exist anytime you develop a new skill.
Right.
So,
Exactly.
we make this big deal that, oh, well, look, this brain is a reading disability brain, and this is a reading brain. So that must be the areas of the brain that cause a problem for reading. Well, if you learn how to do anything new, and you look at your brain before and you look at your brain after, there's going to be a difference. And it doesn't mean that, oh, that must be the cooking fish area of the brain because now you know how to cook fish. It doesn't work that way.
No. And we're not looking at neurons, we're looking at blood flow. We're
Right.
looking at where blood is going, and that tells us that this area of the brain is active. That's all it tells us.
Right.
Is that this area of the brain is active. It doesn't tell us what's going on there. It simply says this area seems to be more active at this time.
Right.
In most brains.
Right. Yeah. And I'm sorry about that. I don't know why I used an example of cooking fish. That was,
Yeah, that's the first time I've heard. Cooking fish region.
Yeah. Hey, I was thinking about a kid learning how to cook
fish.
something. I don't know. I should have come up with something else, but it's early in the morning.
Yeah, that one surprised me. I was cooking fish. What? Okay.
Or tying a bow tie. There you go. That's it. That's a skill that you don't have, and then it becomes.
That's right. If you looked at that's right. If you look at a group of people who can't tie bow ties, and you look at a group of people who can, during the act of tying the bow tie, blood would go to certain regions of your brain and not go to those regions in my brain because they're not developed yet.
Right.
Okay. So that's all it means. It's where's the blood going? Where's the activity occurring? Not what is the activity. All we know is where the activity is occurring. We don't know what's going on there.
Right. And we make some assumptions based upon what the way the typical brain is organized.
Right.
So if a certain area of the brain is getting more oxygen or more glucose, then we say, well, that region of the brain is usually associated with visual perception, and so that must mean that the visual cortex is working. Well, that individual person's brain may be structured a little bit slightly different, and so we don't know. But so with our three types of disabilities, so dyslexia, dyscalculia, and dysgraphia, there are subtypes. Like I said, with dyslexia, we have 4 or 5 primary subtypes. With dysgraphia, the written expression disorder, the student can present with a couple of different challenges. It could be the way in which they write the letters on the paper, the way that they organize the paper, and then we get into issues with, perhaps needing occupational therapy and some of those kinds of things. Rich, I really need to show you some writing samples of some that I've collected recently, and it's remarkable because of the challenges that some students have with writing. And then with dyscalculia, though, we have, you have issues that could be purely associated with just organizing the brain in such a way to understand how numbers work, all the way to actually it's a issue with dyslexia because the student can't read the word problems or some of those kinds of things. And so, you have a variety of issues that could be present within each of the 3 diagnoses.
That's the heterogeneity.
Right. Exactly.
Broad spectrum.
Exactly. And in schools, we don't necessarily differentiate those subtypes. If a student is identified as having a learning disability, we will talk about, well, she needs help with reading or she needs help with math. We don't really do a whole lot with written expression. Unfortunately, sometimes it's just kind of added on to like reading, but we just say that they have difficulties in one of those areas, and then we're going to provide interventions for that. And so, again, the issue with heterogeneity really takes root there because we don't differentiate that stuff.
Right. And the other thing about schools, when these kids present in a school setting, we approach it from a biological perspective. You know, when we find these children who have these, what we believe are brain-based learning disabilities or learning disorders, um, we sort of make the assumption that, okay, this child's going to struggle, and there may be limited improvement, because this isn't because they haven't been in school. This isn't because they've been missing school. It's not because they haven't had good teachers. They've been going to an impoverished school. That's an educational, that's a curriculum. That's what you refer to as curriculum disability. These are kids who, even under the best of circumstances, struggle to learn what they should be learning at a particular chronological age or grade level. As our field was trying to figure out what learning disabilities were, from a biological perspective, there was another group saying none of that matters. Right. It doesn't matter why all the kid needs is intervention. And so out of that movement came that multi-tiered system of support. In other words, we'll work with this child, we'll give this child a little bit of extra help. And if that doesn't work, we'll increase the amount. And if that doesn't work, we'll increase the amount. I think the cruelty there's a cruelty in both camps, whether it's biological or instructional. The cruelty there is that many of these kids are never going to be able to learn. Their brains are structured in a way that they will never overcome. They may overcome the reading disability to an extent, but you take a child who truly has a brain-based learning disability, there are going to be limitations. And that child, we can't assume that child will get to become a fluent reader.
Right.
It just isn't going to happen. And to give parents or teachers the impression that with enough intervention you can get to normal, I think is a cruel hoax.
Right. Yeah. And I think so. Thinking about that, we should mention that there are a couple of different ways in which we identify a learning disability. Traditionally, prior to about 2004, 2000, with the some reauthorizations and things that happened in the early 2000s. Prior to that time, learning disabilities were primarily identified through what we refer to as the discrepancy model. And what that means is we, as psychologists, we would do testing. And that testing included an examination of the student's cognitive ability, or IQ. In some states, we're not allowed to call it IQ. We call it intellectual ability or cognitive ability. So we look at their cognitive ability because, well, we could do a whole podcast on what IQ is, but really all IQ is a predictor of how well a student should do in school. That's really all IQ is. We'll get into that at a different time. But so we would assess the student's IQ. We would assess their academic achievements in reading, writing, and math. And we would make a comparison because, again, IQ should predict about how well a student does in school. And so if their IQ suggests that they would be in the average range, and then you assess their academic achievement scores or abilities, and they're below average, what that suggests is that their academics aren't at the level we would expect based upon their IQ, and that is a learning disability. Right. Then we would be tasked with doing some kind of cognitive processing tests. And my goodness, that's another whole podcast on what in the world is a cognitive processes, because people say, oh, he's got a processing disorder. Okay, I mean, everything that happens in your brain is a cognitive process. So I don't know what that reading is a cognitive process technically. But we would do cognitive processing tests, whether that looks at memory or executive functions like attention and or phonemic awareness or visual motor. That's your favorite, Richard. But we would do some kind of cognitive process to try to identify perhaps a reason why there's this discrepancy. And it is very brain-based. We're looking at a neuropsychological examination of the student to see if we can identify the idea that their brain is not functioning in a way that allows the student to read at the ability level they should be able to read or do math or do writing.
Right. Mm-hmm.
So that was
Yeah, it's just a way of saying, when we go back to the 60s and those parents said, it's not an intellectual deficit.
right.
It's something else. Okay. And so you give an IQ test that says, well, you do have average IQ, but man, you can't read at all.
Right.
That defines a learning disability. It's just another way of defining it psychologically.
Exactly. And so for a long time, that's the way that we identified learning disabilities. But then in the late 90s, early 2000s, we got into this movement began to emerge where they were saying that the discrepancy model introduced this idea of waiting to fail. And what that means is that, if we're honest, very early in elementary school, kindergarten, first, maybe even into second grade, kids don't know a lot. So IQ could be average and their academic achievement scores could be average, even if they really don't know how to do much as it relates to academics. And so the probability or the likelihood of finding a discrepancy between ability or IQ and achievement was pretty small in those early academic elementary school years.
Yeah. You're giving them 2 tests, but there's only so much you can ask a 5-year-old.
Right.
I mean, so there has to be some overlap between those two.
Yeah. And I remember in the early 2000s and even into the mid to late 2000s, testing kids because they would refer kids in kindergarten and first grade for learning disability, reading disorders. And, if they knew how to spell their first name, they're going to come out average. If we could recognize, 10 or 15 letters, they were going to come out as average.
Right.
And, just, stop the assessment if they could read the word in or the word dog, because then it was above average, So identifying a student then was really difficult. And so the waiting to fail idea was that we had to wait until they would be expected to learn enough for that discrepancy to really manifest.
And that was a cruel thing to do to kids, because in those years we knew, for example, that certain kids, certainly by first grade, you get those kids and they weren't learning. There was something wrong, but you couldn't get a large enough difference between IQ and achievement to provide extra services for that child. So the child had to languish without intervention until the scores were large. There was a large enough difference, and that usually was around 3rd grade, fourth grade. So you'd have to wait until you could show it on test scores, which was a cruel thing to do, to get these kids to wait for 3 years before they could get services.
Right, because by then they had missed most of the fundamentals.
That's right.
And now you're going back to teaching a 3rd grader, some of those early phonics and that early phonemic awareness that they should have learned in kindergarten and first grade.
Right.
And they're now learning it in kindergarten or 3rd grade or 4th grade even. So yeah.
And had they gotten the intervention earlier, it probably would have had a much bigger effect. Yeah. So in response to that, district said, well, wait a minute, let's just figure out, let's get a way to figure out whether this first grader really needs extra help.
Yeah. So a lot of educational researchers and we'll just say activists in different states, especially like Oregon and here in Florida and in different states, they really started to push this idea of curriculum-based assessments. And it was first called Response to Intervention, RTI, and that later evolved into what you mentioned a moment ago, MTSS, the multi-tiered system of support. And what that suggests is that if at any grade level, a teacher feels as though, and then we'll come to a team, and then the team feels as though the student isn't progressing at the same pace that the students in the class are, then we can do curriculum-based or classroom-based assessments to see if there's a difference between this particular student and the rest of the students in the school and in the classroom. And if there's a big enough difference, we call that a gap analysis, there's a big enough gap between the student's performance and the other comparison groups of performance, then interventions are provided developed and provided immediately. So this is a very quick process that can happen.
Right. You don't have to wait for test scores to check, right? You can do it the first day of first grade. You can start this process.
Right. Yeah. So there's no longer are we waiting. We are we're looking at what's going on with the student right away and providing that intervention quickly. Right. And then we monitor the progress based upon those interventions. And if the student is still having difficulty, then a more intensive intervention is provided. And we monitor that one for a little bit. And then if after all of those interventions are in place, and if the student still isn't progressing at a rate that we would like for them to be progressing, then they are referred to special education services. Would be identified as having a learning disability.
To get more intensive services.
Right. So now, while that sounds great, because the students, and there are many facets of that are fantastic, there are some other issues with that. In the early 2000s, I remember, and Richard, I know that you remember this article that came out about throwing the baby out with the bathwater. Right. And what that said was that we're moving into this direction of RTI and MTSS, which has a lot of important benefits. But as soon as we started moving in that direction, we got rid of testing. So now we are no longer looking at students through standardized testing that we as psychologists would administer. We're just looking at what the student does in classroom. Well, the challenge with that is that if anyone listening, if you have a student in elementary school, you know that what students are learning in elementary school now is not consistent with what we learned in elementary school. And that's not saying those were the good old days or anything like that, but there are schools where kindergartners are doing book reports, for example. From a developmental perspective, that's not typical.
Right. Just
throwing that out there very bluntly. It is not typical to expect a kindergartner to be able to read, to formulate thoughts, and organize them in such a way that they can do a book report. Right. But yet those are some of the expectations of kindergartners in many schools, public schools.
Right.
And that creates problems, because if a student isn't able to do that, even if they're completely typically developing and they can't do that, they could be identified as having a learning disability.
Right. Yeah, if they can't manage
curriculum.
Right. So it's not a child problem.
Right. And that's where we get into the curriculum disorder.
Right. That's right. And but we've always had, I mean, every school system in the world must match the curriculum to the developmental abilities of the child.
Right.
There's only so much an 8-year-old can do. Doesn't matter what country they live in.
Right.
Biologically, there's only so much an 8-year-old can do.
Right.
You can't teach a 7-year-old calculus.
Right.
They just don't have the neurons. They don't have the experience. They don't have the background. So you don't teach that. Can you teach it to? Are there some kids who can learn calculus at 7? Yeah, but they become newsworthy because it's so odd.
Right. Right.
But the typical 7-year-old doesn't learn algebra and calculus. They don't have the background. And so it's not developmentally appropriate. So the goal is to match curriculum to developmental abilities. And what's happened in our country is the kindergarten curriculum certainly outpaces most boys, 5 and 6-year-old boys are not able to handle that curriculum.
Absolutely. So we end up putting kids through this process and identifying them as having a learning disability, even when there may be lots of other reasons for the difficulty the student is having.
Right.
And so that, and if we did that testing, that neuropsychological testing that we referred to before, from the discrepancy model, we would be able to see that the student is typically developing. We say, okay, even his academics are typical average range. So let's not put him in special education. Let's continue to provide interventions, perhaps. Let's continue to work with him, but let's hold off on a diagnosis of a learning disability until the kid has a little bit more experience and training in the classroom and with these interventions.
Yeah, so before you go to the label,
Right.
let's make sure, let's be certain, let's know what we're dealing with.
Absolutely. And that's what we were talking about last week is, we really quickly jumped to some of those diagnostic labels. And when we do that, we forget about all the other potential explanations for what's going on. So,
Right. Right. And we have to keep excluding all those things, there are many things that can interfere with the child's education, and many of them have nothing to do with the child.
right,
Yeah.
right. Absolutely.
Right.
So with all of that in mind, once we have a student diagnosed with a learning disability, and we'll kind of, from here out, we'll kind of assume that the diagnosis is correct. The student is then eligible for special education. In the school, well, let's first say outside of the school, what that really means is maybe some tutoring, some special support through some of these educational programs, educational companies and stuff with some extra tutoring and support outside of school. But from the school-based perspective, there's a few different levels of services that a student could receive. And the federal law says that we need to serve students in what they call the least restrictive environment. And that means that we need to keep them as much in general education, the regular education classroom, as possible.
Right.
So we do that in a couple of different ways. One is inclusion. That there's a huge movement in the early to mid 2000s to push inclusion. And basically that means that students with some of these learning disabilities and different kinds of disabilities stay in the regular education classroom, and they stay in there the whole time. But then maybe a teacher will come in, a special education teacher will come in and work specifically with a small group of students who are having, reading problems. And so they come in during the reading block and just work with that group to provide them some support. But they stay in the general education classroom.
Right. Because that's where the curriculum occurs.
Right.
It occurs in these classrooms, in these regular education classrooms. And once you take a child out of that room, you're taking them out of the curriculum. And if you keep taking them out year after year after year, they're missing a regular education that would lead to a standard diploma.
Absolutely. So, and so I think I would say a good portion, most kids with learning disabilities are provided support that way.
In the classroom, right?
Sort of the second layer, and that's if an inclusion model isn't sufficient because the student needs some additional individual support or more intensive small group or individual support, then we move to a model called resource. And what that means is that the student stays in the regular education classroom, but during reading block, he might leave the regular education classroom and go to another classroom to work with the special education teacher, again, maybe with another small group of students or something, but works with them separately during the reading block. And then they'll come back to regular education for other subjects and for the rest of everything else for the day. And that's called resource. And then, of course, the most intensive is the student isn't in regular education classroom at all and is completely housed in a special education classroom where everybody in the classroom has an individual education plan. Everyone in the classroom has a learning disability or some other disability that's interfering with their learning. And they just have a special education teacher in that classroom. The students may go to specials like PE and music and art and things like that with the regular education classroom, but for everything else, they stay in the special education classroom.
Right.
So you have these different levels. And again, the idea is to keep them in the regular education classroom with their regular education peers as much as possible.
Right. Yeah, because if you take a kid out, and that's what we learned, these federal laws were developed in the 70s, and after about 10 years of experience, once we got into the 80s, people began to realize that, wow, we're pulling these kids out of regular education and they're falling behind academically. So we said, well, we can't let that happen. So then we started to move toward an inclusion. Let's keep them in the regular class as much as we can.
Right.
And that's inclusion.
Right. And there are pros and cons to it. I think it's great that we do that. But we are very slow sometimes to recognize that some students need more intensive services than can be provided in the regular
Right.
education classroom through a inclusion or even a resource model.
Right.
Some students need more than that. So, but it's good that we are at least considering that, so that we're not immediately going to pulling them out and putting them in a special classroom or even a separate ESE special education school. There are those entire schools that are just for special education. So,
But those are much more restrictive. We talk about the least restrictive. The most restrictive are these special schools.
right, yeah, and so
Because they're not even in the same building.
right. So we typically try to avoid
Right.
that. So,
Mhm.
but so students will get services in there. The services will vary depending on what's going on with the student, what the composition of the class looks like, and the teachers will do different things. Many times there's a teacher with a paraprofessional in there to help out, so that the student teacher ratio is good for providing students with as much individual and indirect intervention as possible.
Right.
So and students are there. The likelihood of a student coming out of special education isn't great. A lot of times, many times, students who are identified with a learning disability in early to mid elementary school, they usually remain identified as having a learning disability through elementary, middle, and even high school. Parents have to be very careful, especially in that around the time that they turn 14, as they're in middle school and starting to transition from middle school to high school, because that is the time in which they make a decision as far as what type of diploma the student is going to earn, to make sure that the student stays on track to earn a standard diploma, or if the concern is that they're not going to pass the tests that are necessary or whatever to meet those criteria. Those decisions are made in middle school. So parents have to be cautious of that. But yeah, it is a bit difficult, especially with learning disabilities, to come out of special education once you're in there.
Right. Because it's not something that is going to go away. I mean, if it is a true learning disability, it's not going to go away. And no matter how hard you work at it, you're going to make some progress.
Mhm.
But the idea that you can make a reader out of a non-reader,
Right,
I think is cruel
right,
to make people think that, to lead people to the belief that, well, my child has, this severe reading disability, but with enough intervention, he'll become a fluent reader. No, your child will improve their reading, but
mhm,
the chances of them ever becoming a fluent reader are pretty low.
right,
And I think that we need to understand that a true learning disability is just that. It's not that you're going to catch up in some way.
mhm,
It is something that you're going to have to work on, and you're probably going to have it the rest of your life. It's like ADHD.
right,
You don't grow out of ADHD. We used to think,
yeah,
years ago, generation ago, we thought, well, eventually you grow up. No,
right,
kids with learning disabilities, kids with ADHD become adults with ADHD. You don't outgrow it, and
right,
you don't outgrow a learning disability.
right, right. And so and that's again where it gets back to, you just have to make sure that the diagnosis is correct.
That's why exactly. That's why a label. That's why the diagnosis has to be accurate, because you have to know exactly what you're dealing with and develop realistic expectations.
Right, yeah.
Yeah.
Because that's the downfall of the incorrect label, that the
Right.
student is there and stays there. And if they're not learning disabled, but they're identified as learning disabled, then that student is going to, you know, that's a difficult path, and really difficult to get out of. So that's the importance. That's why we did this podcast, was to talk
Right.
about that difference, because
Right.
parents and teachers and students even need to be cognizant of that, so that support and services and assistance are provided to those who really need it.
Right.
But if the student doesn't need it, and and doesn't need that label, we're not just throwing that label out there just because.
Right. Yeah, it shouldn't be for an advantage. We should make accommodations for those kids who really need it. And that begins with a careful, thoughtful, and accurate diagnosis.
Right.
What are we dealing with here? Is it a delay or is it a deficit?
Right.
There's a huge difference between a delay, which you assume is going to get better, and a deficit, which you assume is it's something you're going to have to learn how to work with.
Right. Absolutely. So, all right.
Good.
That's everything for learning disabilities that we're going to talk about today, at least. So, and maybe we'll kind of break down some different diagnoses and different things over the next few weeks, just to kind of share some of that. So, but that there is it for today. Until next time, stay happy, stay healthy, and forget to be afraid.